Hello, my name is Rebecca Goulding. I'm an NIHR Doctoral Research Fellow from the Centre for Primary Care and Health Services Research at the University of Manchester. This presentation is a brief look at how I've explored communication between older people with multimorbidity and staff working in primary care, and how I've used the learning from this exploration to design an intervention to improve communication. Firstly, I want to highlight why I chose this area for my doctoral research project. In primary care, threats to patient safety often arise as a result of breakdowns in communication between patients and staff. Thus, improving communication could help reduce risk to patient safety, particularly for older people with multimorbidity who are more likely to experience patient safety incidents. Research and policy regarding communication typically focus on the behaviour of staff, but important aspects of communication are patient as opposed to provider initiated. In primary care, this includes the majority of interactions and expressions of opinions and concerns. To date, little is known about how older people with multimorbidity communicate with healthcare staff and how they could be supported to have safer interactions. In order to design an intervention to empower patients to improve communication and reduce risk to patient safety, we explored the barriers to and enablers of communication for this population in primary care. This was done through in-depth interviews with 28 patients and 18 clinical and administrative staff from general practices. The patients were all aged 65 plus and had 2 to 14 long-term conditions. Just under half were female and just over a third lived alone. The interviews started with general opening questions and included prompts designed to explore people's capability, opportunity, and motivation to enact the behaviour of effective communication. Patients reported needing knowledge and interpersonal skills that, to some extent, they gained over time and as a result of experience. But there were things they forgot to say during interactions because, as one person explained, it's quite an intense experience. Things can slip out of your mind. In terms of opportunity, staff demeanour and practice policies could help patients feel at ease and able to talk about anything, or rushed and discouraged from voicing concerns or asking questions. One person highlighted that if the practice itself has a notice up saying you should do this, then you don't feel out of order. Patients' emotions, such as embarrassment, and beliefs, for example, it's better to see someone than ignore a health concern, also impacted their willingness to initiate interactions, speak up about their concerns, and question confusing or conflicting information. At the start of a series of 5 intervention design workshops, the results of the in-depth interviews with patients were presented to 2 stakeholder groups, consisting of patients and carers, and staff and other experts. Initially, these groups met separately and were asked to identify among themselves what barriers to and enablers of communication should be addressed or supported. In the third workshop, we brought the 2 groups together to discuss the similarities and differences in their views and agree a final list of priorities. In the fourth workshop, we then discussed how this list could be translated into objectives for an intervention to empower patients to improve communication, and what this intervention might look like. That is, how the objectives could be achieved. We then met for a final time to reflect on the nature, format, and content of the planned intervention and fill in any gaps. It was decided that we should show empathy for and seek to strengthen empathy between patients and staff, and that each objective should be addressed in a range of ways, as one size does not fit all. It was considered vital that practices take ownership of and support the intervention, ideally adopting it with enthusiasm and encouraging patients to use it. The intervention includes a variety of objectives to empower patients to engage and communicate with staff from general practices, but those considered to be most fundamental concern encouraging patients to plan and be prepared for interactions and imparting the skills required to convey concerns. Thank you for listening. If you have any questions or comments about this presentation, you can leave these below and I will get back to you. Alternatively, you can contact me by email, find me on Twitter, or visit the study website.